presenting on the comparative intraoperative performance using different fluidic systems. This study was funded by Alcon Laboratories. So the aim was to compare the intraoperative efficacy and post-operative safety of active Sentry and the normal Centurion handpiece using different IOP settings to see their outcomes on the clinical patient scenario. We divided the patient into 3 groups. First group, where phacoemulsification using the traditional Centurion handpiece was used with an aspiration flow rate of 40 cc and a vacuum of 500 to 650. The second group was used the same cataract situation with active Sentry handpiece of the Centurion and similar parameters, and the third group was divided into the infinity group or the gravity fluidics. Amongst the two groups, the traditional handpiece and the active Sentry handpiece, we further subdivided the patients into 2 different IOP settings, that is, keeping the flow rate at 40 and vacuum between 500 to 600. In half of the eyes, we used an IOP of 30, which is considered to be lower IOP, and in the second half, we used 55 millimeters of mercury, and this was followed in both the groups, the normal handpiece as well as the active Sentry handpiece. The CDE and fluid used were the intraoperative outcome measures. The post-operative primary outcome measure was the difference in the CCT from baseline starting from 1 week to 1 month post-operatively, and secondary outcomes were the clarity, cells, flare, so on, and the anterior segment inflammation. When we look at the comparison of the CDE, the active Sentry handpiece had significantly lower CDE as compared to the traditional handpiece of the Centurion vision system. Of course, the infinity fared the worst. And when we come to the mean change in the CCT, when we compared the high IOP, that is 55 millimeters, comparing the 2 groups, there was no change in the significant or no significant difference in the central corneal thickness up to 1 month post-operatively. In the traditional handpiece group, in the post-operative CCT was significantly less when lower IOP was used compared to high IOP. So in the same Centurion handpiece, when we use 30 IOP, the CCT raise was less compared to when we use 55 intraocular pressure. In the active Sentry handpiece, there was no difference whatever IOP we used, whether it was 30 IOP or 55 IOP. When we look at the cells flare within the group 1, that is the traditional Centurion handpiece, they had significant higher incidence of cells on post-operative day 1 in groups A and group B. In group 2, which is the active Sentry group, there was no difference intra-group wise. So there was no difference whether we use 30 mm or 55 mm of intraocular pressure. When we compared the rise and fall is the IOP that was done with the IOP tracing sensors, there was a significantly faster rise of IOP to the baseline following occlusion break in the group 2, that is the active Sentry, compared to when we compared the traditional Centurion handpiece. So the clinical applications of this study would mean that the traditional handpiece had good post-operative outcomes with lower IOP. When we moved the IOP a little higher, the anterior segment inflammation and CCT was higher on the first post-operative week. However, with the active Sentry group, whatever IOP you use, it did not matter even with high flow rates and high intraocular pressure. So, and it also helps in faster surge mitigation. So therefore, I think it will be, you can probably use the parameters of your choice with a low intraocular pressure safely. Thank you.
Shail, one question. What is this traditional handpiece?
Traditional is the normal Centurion handpiece which has the sensor at the cassette. So the active Sentry handpiece has the sensor in the phaco probe itself.
Okay, and why was in group 2 more fluid was used?
So probably what we feel was that probably we were using high and low IOPs along with a very high flow rate of 40 cc. Maybe that may be one of the reasons why more aspiration was being done.
No, but all ranges in 3 handpieces, it was all similar.
Similar.
It was similarly
similar, but there's no statistical difference. Yeah.